$55 million is on its way to help Minnesota patients who have been civilly committed by the courts for psychiatric care. The money is a blessing not only to those experiencing a mental health crisis, but for the county court system that has been shouldering the burden so far. ABC 6 News reporter Chandler Jackson has been following this story for us. He joins us now from the newsroom tonight. And Chandler, where is this money coming from and what exactly is it helping?
Yeah, Robin, this money comes from one of the bonding bills passed during Monday's special session, and it'll be used to add critical bed space to an overwhelmed mental health system.
Last week, county sheriffs and attorneys gathered at the Capitol to ask the legislature for critical mental health funding.
Well, the concern was that we had individuals with mental health issues who were sitting in the jail who were not getting adequate treatment.
The reason why? A lack of bed space to put them. It's been an issue for years, and one that can have severe consequences.
I think the dangers can be all the way from ongoing distress and suffering all the way to self-injury and even suicide.
Dr. Chris Wall is a psychiatrist and chief medical officer for Prairie Care, providing mental health services in Minnesota from traditional talk therapy to inpatient hospitalization. While they don't work with those committed by the criminal justice system, they do understand the risks of not getting the kind of care these people need and the struggle of not having enough space.
Just like if someone needed a heart transplant, there's only so much good that can come from sitting in an emergency department. Having that experience where you're not trusting the people around you and the people around you don't have that specialized training, all of a sudden that's a bit of a gas and fire kind of mix, which can be explosive at times. And it's very hard to see people go through that when we know that we could provide that care if only we had more beds.
Fortunately for those sheriffs and attorneys, this week they got their request. $55 million to the Anoka Metro Regional Treatment Center for a new 50-bed facility.
Last time we've had people that have sat for weeks and months where they've needed that treatment. So this is really exciting to hear.
Now that there's finally been some movement in providing funding for this issue, some officials are hopeful a future direction could be creating regional facilities across the state or even earlier prevention methods. That will all likely take some time though. Robin?
All right. Well, Chandler, I remember when you covered this story last week, there was some discussion about the 48-hour rule along with this funding. Where did those conversations end up?
Yeah, that rule, which to remind people said those who were civilly committed had to be taken to a mental health facility within 48 hours, that rule was removed from legislation as part of the deal to get this funding. Now, instead of having to move people into facilities within 2 days, they simply have to wait until a bed is available, which frankly was already the case anyway with so little space. Live in the newsroom, Chandler Jackson, ABC 6 News.